I will, I'll ask Camille to start us off with the answer for this. What I will say is for me a very important question. And Corinne, if you could follow, and we'll end with you, Adrian. For people living with dementia, stigma has a profound impact. It can make people reluctant to seek help or delay the diagnosis. It also it also contributes to feelings of shame, lower self-worth, and can result in social isolation. And that really is for those living with dementia as well as their families. So I would be interested to know how your party plans to address this and break down stigma related to dementia and address social isolation.
Thank you for the question, Jim. It is a very important question. And to be honest, it's actually a theme that is what propelled me even to start my organization, BC Healthcare Matters, with the patient advocacy focus. It was around stigmas. It was around what people are thinking and misconceptions that develop, and how it does result in a change of our behavior and how we, as either patients or people witnessing others, how we interact. And that became very alarming to me. So I do think this is such an important question. The BC Greens, we often say this, we share this with people, and I think we just need to keep repeating it all the time. The measure of a progressive and compassionate society is how we support the most vulnerable people among us. And the BC Greens want to shape a province that creates the conditions for all people to live with dignity. And that's what you're talking about, Jim, is dignity. It absolutely matters. So we believe we can help achieve this by ensuring safe access to public spaces, services, and supports that meet their needs. We would, again, I feel like we keep coming around to this, so you guys are doing the right thing, is we would love to fund the Alzheimer Society to develop and run a campaign to reduce stigma, with that goal as well, to help support early detection. We'd love to see a 3-year campaign that may come in, around the 10 million mark, making a very significant investment, because that is how important this is to people in this province right now. So we don't have a specific support strategy in place right now for a very important reason, because it goes back to what we've talked about earlier. I think it's important to develop that with associations like yours, who know what is the best information to get it out there, and how do we reach people in the most effective way with key information that will help change their lives, and with having that cultural safety lens on top of everything. We have witnessed, I think it's important for us to all think about campaigns that have been out there before. And we have witnessed campaigns like that, which is around breast cancer, prostate cancer, and we have seen how it has helped diminish the stigma in society. We can talk about breast cancer in public environments. I don't know that we could do that even 10 years ago, certainly not 20 years ago. So these types of campaigns have really encouraged the public to have conversations, and for people to reach out for support when they face these diagnoses or when they're wondering about them. So we would like to see and achieve the same goal with Alzheimer's. If we can bring down these barriers, and if we can make people talk to each other, and we can get people even just a little more concerned about themselves and valuing their right to live with dignity, to live the best life that is absolutely possible for them, then I believe we can improve on diagnosing people earlier, and even improving options for treating them sooner.
Thank you. Corinne.
Thank you. And Camille, I couldn't agree more in terms of the campaign and investing in the ability to talk more about this and talk more openly about it. Part of that goes back to making sure services are available, because if someone is alone and they can't be connected to services, they don't appreciate perhaps that this is something that is more prevalent, that is out there, because they have to wait for a service, which means that we're not investing enough in showing them that there is importance, and that someone is not alone. One of the parts of this was social isolation, and that's a significant part of this. And we saw this in the pandemic. In my community is generally an older population, and what we guessed we had in terms of social isolation during that time was just the tip of the iceberg. There's so many more people here who were on their own and didn't have community support. So making sure that we've got something in place where there is a network where people can be checked on, and whether that is something that's flagged through a family physician or how that is connected, but so that we are aware of people, we know where they are, and there's some kind of ability to check on them and to recognize when they might need more support than they have now. But just let's keep talking about it, and let's just keep making sure that we all know that we can support each other.
Thank you. Adrian.
Thanks very much, Jim. And really, a lot of your work, Jim, has made an enormous difference to, I think, tens of thousands of people in BC. Your willingness to talk about your circumstances, talk about it when it's going well, talk about it when it's not going well, is incredibly courageous. But it also tells us, and this is part of the stigma of it, that there is a vast variety of people living with dementia today, and a vast variety of circumstances of their dementia, of their need sometimes for care and sometimes just for understanding. And so all of us learning more of it at every level, in medical education, in nursing education, across long-term care. We talked about the programs that are in place. The work we're doing as a government with the Alzheimer Society on First Link on education for healthcare workers, and then more broadly in society, is all critical work we can enhance and make that better, I think. Equally, we need to ensure that such education is applied, for example, across a range of first responders, but really public-facing people, whether they work in service industries or other places. That greater understanding will assist us, I think, in breaking down barriers that people have to engage, breaking down social isolation, which is so important. And then there are programs. I mean, we've seen record investment in home support, record investment in adult day program, record investment in respite care, and all of those matter because they support, they provide real supports for people in community. And finally, I think, and respite care is important for this, but it's not the only thing. We need support for families, because often when families are together and dementia becomes a subject of conversation, there's a diagnosis or a concern expressed in a family, it can become not just a problem for the individual, but for their family. So the education and supports have to be beyond the individual in question to their support network. And that's a lot of what First Link does, in fact, is provide support, not just for individuals, but for families. All of those things are things we need to do, because the part of the problem, of course, is that a diagnosis of dementia can lead very easily to hiding it and more problems, and then addressing those problems in a crisis circumstance. The police are involved, fire involved, someone's lost, someone's having trouble somewhere. And to avoid all those things, I think, requires direct investments, say, in education, in services, and supports for people, and a public discussion about these questions. And Jim, you're an exemplar of that.
Thank you all for the answers, the responses.